You might have heard CHI Health has one of the nation's top heart programs. It is award-winning.
As we imagine better health, the important points about why their heart care stands out, specifically with heart failure. Dr.
Eric Graaff is a CHI Health cardiologist. Doctor, good to see you this morning.
Good morning.
Thank you.
Well, we're talking heart failure, but I didn't realize heart failure, somebody could be going through it not even knowing it. What's going on with the body?
Well, at some point, anybody who gets the diagnosis of heart failure, before they get diagnosed, they have symptoms, and in many cases, they don't know what's going on. In fact, we've had a lot of people referred to us who think they have the flu or a prolonged cold or something like that, some respiratory problem. Congestive heart failure is where the heart weakens or the heart has lost its ability to keep up with the circulated blood flow, and so pressure builds up upstream from the heart, and they get swelling in the legs, they get swelling in the tissue of the lungs, making it very difficult for them to be able to get oxygen in and get rid of carbon dioxide. It's a gradual process. It's not like a heart attack where it's sudden, where they feel the chest pain. It's something that sometimes comes on so slowly that they feel like sometimes it's just a function of aging, or they feel like they're just getting out of shape.
How common is it?
It's very common. It's the one of the most common causes of hospitalization in our country. It is becoming more common because, unfortunately, in our country, we have an epidemic of diabetes, obesity, hypertension. We don't do a particularly good job of taking care of ourselves, and these are all risk factors for damage to the heart.
Yeah, but as it gets worse, I mean, some of these might start with mild symptoms, but it eventually gets worse. What do patients experience at that point when it's starting to get real serious?
Sure. The most common symptom would be breathing difficulties. Like I said, it's hard to get the air into the bloodstream to get oxygen to the tissues. And because of that, they just get more and more out of breath. And it starts initially with activity. They find that they can't walk up the stairs like they used to be able to. And then ultimately it gets to the point where as they lie down at nights, because they get more fluid in the lungs, they get more out of breath. And then by that point they come to us. But a lot of people suffer with this for months before they come in.
Why, for you personally, is education such an important part of this story?
Well, it's two parts, really. One is education about the risk factors for congestive heart failure. Treating blood pressure, treating sleep apnea, treating diabetes, other things that can lead to damage to the heart. There are many things that over time can take its toll on the heart. The second is education of people who have the diagnosis of congestive heart failure. They know they've had this in the past. Our job is to keep them out of the hospital, to keep them functional and feeling good, and with that, they have to keep on top of their diet. Like you pointed out earlier in the program, they have to watch their salt. They have to weigh themselves every day, because sometimes the earliest clue to having more congestive heart failure is simply a gain of 1 or 2 pounds over a couple of days.
Water retention.
Yeah,
exactly.
Yeah, and you're talking about heart failure when it gets to the point that it's very serious. It could mean a lengthy stay in the hospital, but there have been some advances in your industry, haven't there, to help keep people out of the hospital?
Sure, yeah, advances both in monitoring and in treatment. Heart failure is an interesting entity. If you were diagnosed with heart failure 20 years ago with a weakened heart, your life expectancy over a 5-year period would be about 50%, which is similar to certain types of cancers. People don't think of it that way, but it used to be a death sentence for many people. Nowadays it's very treatable. We have medications that can limit the symptoms, can limit the progression. There are new technologies for monitoring the heart. They can be used at home. We also have new therapies in the form of pacemakers, defibrillators, that sort of thing.
There's a device that monitors things wirelessly and sends the data back to your office, so that patients maybe they don't even know what's going on, but you know what's happening because of that device. What is it called?
It's called CardioMEMS. It's a very, very small chip-like unit that is inserted into the one of the blood vessels in the lungs. And as people take on more fluid, and even before they get symptoms, even before they have a rise in weight, what happens is the pressure starts creeping up in the lungs. And this is a device that every day checks this pressure, and if there's a certain rise, it sends us a notification. We can call the patient, have them change their medications, have them come in.
And all this is available because you have the designated heart failure clinics, which kind of sets you guys apart from the others out there. Can you, we've got to wrap this up, but briefly explain why that's better.
Sure, yeah, at one of our hospitals, Bergen, we have an entire clinic staffed with nurses and nurse practitioners who monitor patients with heart failure. That's all they do. They'll have the patient come in, do education, and then they'll have the patient go home. They weigh themselves every day. They have the ability to call the nurses. The nurses can then direct them on how to dose their diuretic medications. They can come in and receive IV medications without being hospitalized. And again, the key here, keep people healthy, keep them out of the hospital.
It's such a great place to leave this conversation, but I want to direct our viewers to your website. You were just looking at it there. It's chihealth.com/heart-care, and we'll link you back from our website as well. I think it's really good to read up and know before you're in an emergency situation so that you're able to just take better care of yourself. That's the key.
Yeah.
Thank you, Doctor.
Dr. Vandergraff, not only one of the best doctors, a great pianist too. Great pianist. I've seen him play live.
So gifted.
Yeah.
Well, thanks for having me, and thanks for talking about this subject.
You bet. Yeah,
It's our
important.
pleasure.
Thanks, doctor. Appreciate it.
Well, ahead of Halloween, you only need